Hey y'all, I wanted to give you a full overview of what checkoffs would look like next week. So you already have access an EHR tutor to your patient. So when you come to campus, I will give you a patient. I will get into the program for you and I will give you a patient. And when you get into that patient, I'm going to tell you, Miss Agnes is your patient, Mr. Beback is your patient, Miss Jenkins or Miss Roney is your patient. So once I give you that patient, you're going to choose their name to ensure that you are in the right chart documenting on the correct patient. Once you choose their name, you are going to go into a room with two patients. It is then your responsibility to make sure that you identify, if Al Beback is your patient, that you identify Mr. Al. So that's what we're going to do right now. So I am to be given medications on Mr. Al. These are the medications that I will be giving under the MAR. This is just like what you have at home. So if I know that I'm giving Captopril and Cipro and Flagyl and insulin, I know that I'm going to need to know his blood pressure and I'm going to need to know his glucose. So those things will be readily available in the chart that y'all have had a chance to dig through. They will be found under labs, and all of that will be exactly where you need it to be. So Mr. Beback's glucose is 230, and his blood pressure will be found under patient summary. Now, if you have difficulty looking for these things, I don't want to walk you through this, but if you know that you're looking for the blood pressure and you're just having a hard time finding it, I will help you guys with that. And his blood pressure is 156/94. So his medications are appropriate. So I'm going to go into my patient's room. I'm going to perform hand hygiene. Now I'm going to say, good morning, how are you? I'm your student nurse. I'm here. I'm going to get you some medications prepared for the day. I just want to check your allergy band and your wristband. And so I will ensure that my allergy band matches the chart that I have. So I have both of them on this same patient, but you will have two patients to choose from. So Mr. Al is the patient. Mr. Al will have an armband with the appropriate name band on there, with the appropriate name. All right, so what I will do next is I will take my little WOW to my medication room, and I will pull out the medications on this MAR. So at this point, I have left the patient's room. I am using this only to pull them from the machine. I'm using my MAR and my machine. So from there, you are going to go back to your MAR, and you are going to find your medications. So Captopril, I will go to the drawer with the C's. I will pull out the correct medication, and I will get it ready to go. So this isn't the ones that I had labeled. So we might have to stop. I'm not in the right patient's chart for the ones that I got prepared. So stop it for a second.